was supposed to buy us time. It was supposed to give the federal government time to ramp up their testing, contact tracing to suppress the number of infections. Well, now it's been obvious that they've squandered that time. We have let those sacrifices go in vain.
This is what a world emerging from months of lockdown looks like. While there have been setbacks, mutations, and new spikes of the coronavirus, much of Europe, Canada, Vietnam, and other countries have managed to flatten the curve. And then there's the US. For months, the US has had the most new infections and deaths worldwide. So if other governments have been able to get the disease under control, who's to blame for the failure in the United States?
It will go away, just stay calm, it will go away. A lot of people think that goes away in April with the heat, as the heat comes in. Typically that will go away in April. We're in great shape. You treat this like a flu.
I decided to ask an expert. Dr. Leanna Wen is an ER doctor and was the public health commissioner for the city of Baltimore. What is the science saying?
Well, the numbers do say that the new surge of infections is primarily driven by young people. So, for example, back in March, the median age of infections in Florida was 65. It's now 35. There are multiple counties and parts of Texas where the average age of people with COVID-19 is in their 20s.
I got 10 calls, all of whom young people who otherwise would be excellent candidates to be able to put on ECMO. They're so sick that if they don't get put on, they don't get that support, they're probably going to die. I had 3 beds.
But I don't think that it's accurate to say that young people are to blame. If anyone is to blame, it's the Trump administration for not having the testing, contact tracing, isolation, the public health infrastructure in place so that we are in this position that we're in now.
Oh, the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax. We're going to defeat the invisible enemy. I think we're going to do it even faster than we thought. And it will be a complete victory. It'll be a total victory.
Air Force Academy set to become one of the first universities in the nation to welcome students back on campus this month.
You wish you could go and be there.
But Alexandria Cubias knows the dangers of COVID too well. She lost her father and sister just days apart.
I never, in 100 million years, I will never wish this for anyone to go through.
Tonight, one family's unimaginable loss as a record number of Americans become infected with the virus. Miguel Almaguer, NBC News, Los Angeles.
And 5 million within a month, I doubt we'll need anywhere near that. As of this moment, we have 50 deaths, which is a lot of good decisions were made, or that number could be many times that. So healthy people, if you're healthy, you will probably go through a process and you'll be fine. 15 people. Out of billions of people, 15 people. Yeah. They're getting better. And soon they're all going to be better. Hopefully it's going to disappear. One day it's like a miracle, it will disappear.
There are now more than 15 million cases globally, according to Johns Hopkins University. Coronavirus has taken the lives of more than 617,000.
We have it very much in hand. It's going to all work out. Everybody has to be calm. It's all going to work.
Dr. Wen has a point, and that's why many countries have been able to reopen while flattening the curve. But the US's curve is looking like this. Mask wearing, contact tracing, and social distancing have proven effective in fighting COVID-19 elsewhere. But in the United States, people just aren't getting how important these things are. Americans, young and old, are getting a lot of contradictory advice. For example, while the governor of Texas blames young people, he initially banned Texas municipalities from making mask wearing mandatory. He eventually reversed that order. But a week later, the governor of Georgia started suing cities in his state for making mask wearing the law. And at a critical time in March, when many states were going into lockdown, the governor of Oklahoma was encouraging people to take their families out to restaurants.
Is it safe or appropriate to be holding rallies during a public health crisis like this?
I think it's very safe, yeah. I think near the end of our historic battle with the invisible enemy, I think it's ridiculous. We don't have to do it. A lot of those states could go back right now, and they probably will.
It's becoming more and more likely that you or someone you know personally has been infected with coronavirus. Tonight, the running tally of confirmed U.S. cases has reached 4 million. While many recover or do fine, deaths continue to climb. The death toll now nearly 145,000. And tonight, urgent attention being directed towards nearly a dozen cities in deepening trouble.
Officially eclipsing 4 million infections, tonight the true number of COVID cases in the U.S. is without doubt significantly higher. The new milestone reached today as a top health official sounds the alarm for 11 American cities in trouble after testing results came back from metro areas like Cleveland, Columbus, Minneapolis, and New Orleans. Dr. Deborah Birx, in a private call obtained by the Center for Public Integrity, warned local leaders they need to take aggressive steps to mitigate their outbreak.
Many doctors, and I've read many doctors, they can't believe the great job that we've done. Doing it the way we're doing it is much better. It's really much better. America will again and soon be open for business. Very soon.
But while many countries have been leaving it to scientists or public health experts to guide the response, we've been getting a lot of this.
And then I said, supposing you brought the light inside the body, which you can do, either through the skin or in some other way. Hydroxychloroquine. Right now, yeah. A couple of weeks ago, started taking it. Because I think it's good. I've heard a lot of good stories.
California tonight with a dubious distinction, now home to the most coronavirus cases in the country. But the reality is records and benchmarks are falling almost daily across many parts of the country, including the single-day death totals. So many numbers, and sadly too easy to forget, they represent real lives. In dozens of states, the numbers are worsening, and progress is hard to come by.
As people get better, I mean, most people are getting better. Most, by far. The people, you get better. Tremendous control of it.
And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job. And people have to remain calm. Be calm. It's really working out, and a lot of good things are going to happen.
China made mistakes. They need to be called out for them. But the president is trying to deflect attention from his mistakes in the United States that have led us to have the highest death toll in the world.
This is just a temporary moment of time. Things are going very well, as you see.
Do you believe it's inevitable that the coronavirus will spread across the country?
No, I don't think that's inevitable at all.
The numbers are worsening, and progress is hard to come by. We have expanded coverage this evening, starting with Miguel Almaguer.
As hospitals and hotspots face a crushing wave of COVID patients, tonight the nation's death toll hitting a staggering new high for July. More than 1,000 deaths reported in 24 hours.
These deaths are premature preventable deaths.
With 40 states responding to an increase in infections, tonight California surpassing New York for the nation's most cases, though fewer were tested, and the death toll is more than 4 times higher in New York. The sobering milestone out west plagues a region that led the country in stay-at-home orders, but is now being crippled by COVID.
Here in Los Angeles, amid long lines for testing, officials are struggling to conduct contact tracing for those who test positive, perhaps fueling the spread of the virus.
The news is also grim along the Arizona border. In Santa Cruz County, a jaw-dropping 55% of those tested yesterday have the virus.
It's a very serious situation.
To slow the spread nationwide, today retail giants Home Depot and Kroger began requiring masks inside all locations, joining states like Ohio, Minnesota, Indiana, and cities like Washington, D.C. and Baltimore, which are also expanding their own policies tonight amid a crush of COVID cases and a warning the virus will linger.
I don't really see us eradicating it, but I think we will bring it down to such a low level that we will not be in the position that we're in right now.
At Niagara Falls, images of American tour boats tightly packed and Canadian vessels with plenty of room, an example of how 2 countries are addressing the virus. New York's tri-state area now warning visitors from 31 states they must quarantine if they enter the region. In Manhattan, Larry Kelly spent 51 days on a ventilator, finally cleared to go home today.
My wife saved my life. She wouldn't let them pull apart.
But not all families are so lucky. Kerry Crosswhite lost his fight against COVID overnight, surrounded by his wife and children, there to say goodbye.
So we were able to have the opportunity to tell him how much we love him.
Tonight, the lives behind the numbers as the death toll and the heartbreak mounts. Miguel Almaguer, NBC News, Los Angeles.
For today, the global death rate at 3.4%.
Well, I think the 3.4% is really a false number. Now, this is just my hunch. Personally, I would say the number is way under 1%.
At this moment, we think we have it very much in hand.
Today, my administration reached a historic agreement with Pfizer to produce and deliver 100 million doses of their vaccine immediately following its approval. Hopefully, the approval process will go very quickly, and we think we have a winner.
A solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No. Probably not. This is going to go away.
Without a vaccine, sir, why do you think the virus will just be gone?
It's going to go. It's going to leave. It's going to be gone. It's going to be eradicated. But with or without a vaccine, it's going to pass.
Tonight, flooding the zone. President Trump appearing in the White House briefing room for the second day in a row, announcing a major agreement with the drug company Pfizer to get millions of doses of vaccines to the public once there is one.
The virus is going to disappear. It's a question of when. This is going to go away without a vaccine.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so. We're in great shape compared to other places. We are in really good shape.
What do you say to Americans who are concerned that you're not taking this seriously enough, and that some of your statements don't match what your health experts are saying?
That's CNN, fake news.
Vaccines are getting tested real time, says Dr. Anthony Fauci, with 70,000 new cases each day.
That's bad news for public health, but that certainly facilitates the development and the proving of the efficacy of a vaccine.
I always say, even without it, it goes away. The numbers are very minuscule compared to what it was. It's dying out, I think.
Responsibility for that?
No, I don't take responsibility at all.
Can you imagine standing up when you're a president saying it's not my responsibility? I take no responsibility. It's not. I mean, literally.
Those words didn't come out of our mouths while we were in office.
Though the president was asked again about taking responsibility over the weekend.
Do you take responsibility for that?
Look, I take responsibility always for everything. I think that at some point that's going to sort of just disappear.
By the way, on July 15th, Kevin Stitt revealed that he tested positive for COVID-19. For Dr. Wen, the lack of clear communication has been a huge factor.
We know that public health hinges on public trust, and that public trust occurs when people know that they're receiving the most accurate information. People also understand that we may not have all the answers, and so it's really important to talk about here's what we do know, here's what we don't know, and here's what we're doing in the meantime. Here are the action steps that we're taking in order to safeguard people's health.
Do you think that some of these officials are in fact to blame for some of the mixed messaging that's been getting out there?
It is not helpful for advancing the public's health when there are mixed messaging, even conflicting messaging that's coming from political officials versus public health officials.
From day one, the U.S. has lacked a national strategy, while other countries have developed coordinated nationwide programs. The president has left individual states to come up with their own plans for fighting the pandemic. At times, this has even meant that states were bidding against each other for urgent medical supplies, even as people have been able to freely travel between different states with different levels of closure.
I know that we are 50 states and territories and we have this different model, but you know what? Other countries have their various models of governments too. Yet they've recognized that a piecemeal approach does not work. In my state of Maryland, our governor had to secure 500,000 tests from South Korea, a state negotiating directly with another country to get testing, and most absurdly of all, he had to get the National Guard to physically guard these tests to protect them from, get this, the federal government, because he didn't want the federal government to be confiscating the tests that he had to get.
And if you think that's bad, let's talk data. The total number of U.S. cases has gone past 3 million, and more than 130,000 people have died. By the second week of July, as the world was recording around 200,000 new cases a day, 60,000 of them were in the United States. That means the U.S., with 4% of the world's population, is seeing more than 30% of its new cases. The president's solution?
You're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please.
But while essential workers, many of them young people, many of them people of color, have put their lives on the line during this pandemic, the president and vice president decided to hold an indoor rally, despite the warnings of health officials.
I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States.
There are many people in the US, many millions of people who look up to President Trump as their most trusted messenger. And so he has an obligation to them and to everyone in the country to be the role model. Indoor rallies and events where there are many thousands of people gathered together, shoulder to shoulder with no social distancing, where masks are not required, that's the most dangerous type of setting. There was just a new model, for example, released that showed if everyone wears masks in the US, we could save up to 45,000 lives between now and November.
Florida has become the new global COVID epicenter. The state is seeing more daily cases than New York did during its peak infections. And while some people of all ages have been selfish,
one day we're gonna die, so might as well go out with a bang.
We can catch it here or home. Which one you rather do?
It's been kind of boring sitting in my house. I love my fiance, but there's only so much we can handle of each other.
It's the officials who went against the CDC guidelines and reopened the state early. And it's the governor who insists on kids going back to school in August.
I'm confident if you can do Home Depot, if you can do Walmart, if you can do these things, we absolutely can do the schools.
Meanwhile, President Trump makes statements like this.
We show cases, 99% of which are totally harmless.
It is simply not true that 99% of infections are harmless, as President Trump has said. It's a lie. This is just not based on fact.
And US officials can blame young people all they want. But the truth is, this has been a public health disaster. As European countries move to reopen, the EU has barred Americans from traveling there. Canada and Mexico are doing the same. At this critical juncture, if you could give this nation's leadership some key advice, what would it be?
3 things. One is we must have a national coordinated strategy. It's long past time for us to do that. Second, we need clear, consistent messaging from everyone. The messaging cannot be contradictory. And the third, we cannot wait. This is a disease that's already claimed 130,000 lives. We know that we're having now 60,000 new infections in the US every day, which is triple what it was just a few weeks ago. There is no more time to wait, and really we need to focus on saving lives.
We have met the moment, and we have prevailed. Go away at some point, it'll go away. If we stop testing right now, would have very few cases, if any.
The push to take quick action, no surprise to the mayor of Indianapolis, where the pandemic has exploded.
Over the last week, our city's positivity rate has jumped by nearly 50%.
As states like Florida set new hospitalizations and death records, in hard-hit Texas, morgues are so overwhelmed, refrigerator trucks are arriving in one county to store the dead.
Good evening. It wasn't that long ago the rest of the nation watched in horror as New York became the epicenter of the COVID crisis, at one point losing hundreds of lives a day. Well, tonight, health officials say some of the country's biggest states are becoming the next New Yorks, simply overwhelmed by the virus. And while there are positive signs in some of those hotspots, officials are doubling down on efforts to get Americans to change their behavior to slow the spread. We have all the latest, starting with Miguel Almaguer.
Setting daily records for the number of Americans who lose their lives, require hospitalization, and who are testing positive for the coronavirus. Tonight, states like California, Florida, Texas, and Arizona are now becoming the next New York, according to White House officials.
We have to change our behavior now before this virus completely moves back up through the north. This first wave that we see now across Florida, Texas, California, and Arizona began with under 30-year-olds.
And while there are signs of a possible plateau in some of the nation's new hotspots, those on the front line are overwhelmed.
It is exhausting. I think we're all in sort of crisis mode right now.
As Texas approaches 400,000 cases, the Austin Convention Center could be needed to house the sick. In small communities, funeral directors say the reality is grim.
We would do 7 to 12 cases a month. We'll probably meet with about
2 families a week. Right now, at each firm, we are meeting about with 4 to 5 families a day.
To protect the public, today McDonald's and retailers like Bed Bath & Beyond join dozens of others requiring masks in stores.
You have a mask on?
And now from California,
please cooperate with us,
to Florida, tickets are being issued to those who refuse to comply.
I ain't paying it. As simple as that, I'm not paying it.
Every measure being taken is done to protect the nation from another shutdown, and every community from another death.
In California, Elodia Noriega died in a nursing home where 118 people were infected.
I feel my grandmother was failed in many ways by the system.
Granddaughter Claudia Rampel says COVID inflicts the loneliest of deaths.
There's never any going back. She's gone. She lived her final months alone.
Tonight, one family's loss amid a national struggle. Miguel Almaguer, NBC News, Los Angeles.
15 states setting weekly records for cases, 9 reaching new highs in deaths. The disease now infected more than 4.1 million people in the U.S. and killed more than 146,000, with more than 59,000 in hospitals.
Globally, cases have topped 16 million with more than 640,000 deaths. ABC's Stephanie Ramos is outside a hospital right here in New York City with the very latest. Stephanie, good morning to you.
Dan, good morning. For 5 straight days here in the U.S., more than 1,000 people have died each day from COVID-19. That's according to the COVID Tracking Project. The number of deaths going up after dropping throughout May and June.
This morning, Florida has surpassed New York to become the state with the second highest coronavirus cases. California, with the largest population in the country, has the highest. Some frontline workers are fearful as Florida officials start looking at how to reopen bars, closing them recently after a surge in cases.
We don't want to sacrifice our economy, but it can't be at the risk of the lives of our community either.
According to internal FEMA memos obtained by ABC News, 53 Florida hospitals have reached ICU bed capacity, several of those in Miami-Dade County, where an 8-year-old boy was hospitalized for more than a week with multi-inflammatory syndrome caused by COVID.
The secondary syndromes that stem from this are horrifying and terrifying as a parent.
Zane Walmber was on a ventilator for a day and is still battling the rare condition affecting children.
If I can help somebody else, another parent, not go through what we've been going through, it would be very helpful.
In Louisiana, hospital workers dealing with a surge. Military medics brought in to help with staffing as hospitals reach max capacity. Shortages in healthcare workers being reported from small towns to big cities nationwide.
We are incentivizing them with dollars, but at some point it doesn't matter how much you pay a person to work. They just can't physically do it anymore.
With COVID on the rise in 37 states and Puerto Rico and Washington, D.C., Dr. Deborah Burks speaking with our affiliate WXYX.
We're asking them not to go to bars. We're asking them to wash their hands and to not social gather with large groups of people.
And in Virginia, a reunion 103 days in the making. Luis Velasquez finally reunited with his family after battling COVID-19 for 3 months.
I realize now during this time how much you can love someone until the end, in sickness and in health.